Good evening, everyone. I'm Dr. Allan Perel, and this is Conversations in Medicine. This program brings cutting-edge topics to the community, both on Staten Island and throughout the tri-state area. It's my absolute pleasure to have Dr. Efrat LaMandre with me here. She's a nurse practitioner. She has her Ph.D. in integrative medicine, and really to give I was going to say fresh perspective, but that's not the real case. She's really going to bring a different kind of perspective to how we take care of patients, how we think about patients. What she brings to patients is very unique, and we have a lot of patients in common. And it's really a pleasure to have such a wonderful clinician with me. So please, thank you so much.
Thanks for having me.
I know you're a nurse practitioner, and I know we've had shows in the past, so I know you were describing what a nurse practitioner was. But just maybe for our audience who might not have seen it before, tell us a little bit about what a nurse practitioner is, and then a little bit about your Ph.D. in integrative medicine.
Absolutely. So for an NP, first has to be an RN. And after a certain amount of years as an RN, he or she can go on to nurse practitioner school, where they learn the next part of medicine, where it's about diagnosing and treating. So nurse practitioners can have specialties. They can be in geriatric, pediatric, psych, family. Again, there's probably more, but this is all I remember. And then after that, you can go on to either your doctorate of nursing or a PhD in something else. I chose to get my PhD in integrative medicine because of a personal health journey that my wife went through, and we just felt that we needed a little bit more than what conventional medicine has to offer.
So tell me about your practice. I know you see patients, and that's always a wonderful thing as a clinician, healthcare provider. So where do you see patients?
So locally, I see patients at EG Healthcare, and that is more of a conventional medicine model, pediatric, adult, and geriatric, and we have house calls. But then on a national level, I'm able to coach people on what's called functional medicine or lifestyle medicine. And this allows me, it's not practicing medicine, it's coaching, so it allows me to really take care of humans all across the country. So it's been wonderful. And people come to me with various issues, either various aches and pains, and they have not yet been diagnosed, and they just don't know what to do about how to feel better, or they already have some diagnosis and they want an additional approach to be able to either control flare-ups or taper medications.
And it keeps you busy.
Oh, it keeps me busy, yes.
I'm
and
sure.
I love it so much.
I'm sure. So I asked you, we know each other, and I said, what would you like to talk about tonight? And you said, I'd like to talk about irritable bowel syndrome. And I said, okay, I'm a neurologist. We could ask the questions about irritable bowel syndrome, see what it's all about. And the next sentence you said, I don't believe it exists exactly in that form. I said, okay, we'll be controversial. I mean, for our audience, and because a lot of people have talked about different things, and we're going to try to break down irritable bowel syndrome, and you're going to help me. There's some of the medical model that I know about immunologically with diseases like Crohn's disease and ulcerative colitis. The most common thing that I've heard, you can't go to a restaurant today without someone saying, I've got celiac disease, or all various intolerance to various proteins, particularly with celiac disease, gluten intolerance. And people say, I can't eat this, I can't eat this. And sort of you look at them and you're saying, but you're eating some bad things there, but does it really have gluten or not? And so that's what we're going to talk about tonight. So let's start from the beginning and say, tell me, what do you think? A lot of people have been diagnosed and are walking around, and people who are watching us here tonight say, my doctor, my healthcare provider, my family member said, you have irritable bowel syndrome. And maybe tell us a little bit about why people said that to them and why you don't think it's really exactly the syndrome that they think it is or the medical condition it is.
Well, I want to say this. Of course, it exists in the sense that these people are suffering, and if you're suffering, I validate you. But my concern is that when we slap on that diagnosis of IBS, we've done the patient a disservice. Now, you've also mentioned Crohn's and ulcerative colitis. That's different. That's IBD.
IBD meaning?
Irritable bowel disease. That is very different. Actually, let's go back a minute. If you have stomach issues, and the first thing you need to do is be evaluated by a GI. Don't skip that part just because you watched the show or you saw somebody on YouTube, right? Make sure you're evaluated. Make sure that there's nothing more serious going on. Get the colonoscopy, get the endoscopy. Don't skip that part, because some of the symptoms are going to overlap on things that are very, very serious, and you don't want to miss that. So that being said, a lot of people will say, I have bloating. Sometimes I have diarrhea. Sometimes I have constipation. No matter what I eat, I'm uncomfortable. It's this sense, sometimes it's hard to figure out the pattern, but it's this constant discomfort after eating. And they go for the colonoscopy, and they go for the endoscopy, and they go for various testing, and it all comes back negative. Colonoscopy is great, endoscopy is great, blood work is fine. That is generally when you get the diagnosis of IBS, irritable bowel syndrome, which basically means it's just describing your bowel's irritable, it's a syndrome, sometimes it's diarrhea, sometimes constipation, have a nice day. And so the patient walks out and says, some of them feel validated and say, oh, okay, I finally have a name for what I feel, irritable bowel syndrome, IBS, but then what? But then what happens? Like, what is actually the root cause? And the problem that I have with it is that it is a descriptive diagnosis, and yes, it has certain criteria, but it actually doesn't address root cause, and it doesn't offer a solution. After that, you can get some medication. If you have diarrhea, get medication so you can go to the bathroom. I mean, to stop the diarrhea. If you have constipation, you get medication to help you go to the bathroom, but nothing's actually solved.
So those are just symptomatic therapies. So basically, anybody taking a medicine who has constipation will move their bowels more. People who have diarrhea, even if you just anyone, that will slow it up.
Right.
So it's not going to anything affecting what the cause of this is. Okay.
Yeah, or they'll take antispasmodics, right?
Right.
Or so they're not really getting to root cause. So my contention is, if you've already been diagnosed with this, it cannot be enough. We have to continue looking at what is the root cause of why your stomach is always on fire one way or the other. It doesn't make sense. And the scary part is, if we do nothing, we just say it's just IBS, eventually, over time, something will go awry. We will finally get the abnormal on endoscopy or colonoscopy because inflammation, you're going to have this constant state of inflammation, this constant state of unwellness. Eventually, that will lead to disease. So instead of waiting for that disease to happen, we really should start kind of taking a look at what's causing that. Now, you mentioned the restaurant, which is a really good segue, because a lot of what people are experiencing is actually a sensitivity to food. Now, you said celiac, and celiac are people who have a severe reaction to gluten, but celiac are also people who, when tested, will come up positive for celiac. But there is a whole world of non-celiac gluten sensitivity, NCGS. These are people who are sensitive to gluten, but they will not come up positive on a celiac test. Now, in the past, we used to say, and there are still some colleagues, they'll say, you don't have celiac, you're not sensitive to gluten, stop, don't be silly. And that's not really accurate, because a lot of people who eat gluten will feel markedly unwell, not just in their belly, in their joints, in their brain fog. It can be systemic. So one of the first things we have to consider with someone who has IBS is food intolerances. Now, this brings us to the conversation of leaky gut. Is that something you've ever heard of?
I've heard the term.
You've heard the term, okay. The fancy term for leaky gut is intestinal permeability. Basically, on a simplified level, your gut has a wall. Its job is to keep the bad stuff out of the system, so you could poop it out, and let the good stuff in. So you imagine a wall with some gates. And for some people with leaky gut, that wall is a little bit more permeable. It's a little leaky. It's not actually leaky. You won't see it on endoscopy. It's on a small molecular level. And people who have leaky gut, certain proteins like gluten will now go into their system, and they will have reactions. So people with leaky gut are going to be very sensitive to certain foods that don't make sense to you so much. That's why you're like, but how are you eating this and not eating that? Because it doesn't make sense to you. Like, how is this possible? How are you eating fried food, but the gluten is what sets you off? And sensitivities are a bit irrational. They're just there. So you have these sensitivities, which can cause these severe abdominal reactions, right? So part one of that is to identify those intolerances and remove them, right? To remove that. So the first thing you want to do is try to see if you can heal the belly. So there's a whole kind of protocol to do that. It's called the 4R protocol, and where you remove the offending agent, You replace, if necessary, some digestive enzymes. You re-inoculate with probiotics. You repair, again, with certain supplements. And then sometimes there's a fifth R, which is like reintroduction. So you really want to heal the belly. But without even getting into details, the point of all of this is to say there has to be a reason for this IBS. There has to be a reason, and we have to start looking at that. Is this making sense so far?
Thank you for clearing it up for me. I like it.
Sure. So then it seems, okay, so that was pretty clear, like, all right, let's look at food intolerances. But then there's more than just in food intolerances. What if there is, for some people, there's a systemic situation? What if there are some other, another known cause of IBS? Or some people are exposed in an environment to mold or other chronic issues like Lyme. And so now you have someone who has some food intolerances, some angry belly, but they also have this kind of underlying inflammatory or infectious process that's pushing this along. So if people are mold sensitive and they're living in a moldy house, this is going to exacerbate things. If they have unknown Lyme and they went camping 5 years ago and they don't know that they have chronic Lyme, by the way, many of my colleagues do not agree with me on this, but that's okay. And now you have this underlying low-level kind of inflammation that is also going to be agitating certain parts, including your belly. And while it's kind of beyond the scope of this evening, and we could spend hours and hours talking about it, the point I'm making is that there is definitely more to your belly than just calling it IBS. And it's really imperative that we figure out what it is that's making your belly so unwell, because it will affect the rest of you.
So someone comes into your practice, goes to their primary care physician, healthcare provider, and they have these symptoms. And they've had some tests, they went to the gastroenterologist, and the gastroenterologist did these tests, and everything looked okay. Now, the question is, what do you do? So if their primary care person is saying to them, well, the workup is okay, avoid foods that are bothering you, it falls into the category where if I do this and it hurts, stop doing that. But that's actually not always so great if you're a baseball pitcher or you have to live a normal life or walk normally. So what approach do you have? So say someone, not that everybody has to come to your practice, it would overwhelm your practice, but as a generalist and somebody, and think about all the physicians that are out there, and what do you think, what questions do they need to ask? And here's, as a practicing physician, and sometimes this is right and wrong, we're looking for some confirmatory test. We want something that we could say, wow, you have this. Or if somebody has a protocol of trying a medicine or trying a lifestyle change and it works, then we're happy also. So it doesn't mean that I always have to have a test, but if changing something around makes it work, it's just as good for me. So how do we make our patients, our audience, people who are all out there, and these are millions of people in the United States, thousands of people who are watching us tonight, and what would you actually do for someone? Workup is negative, your primary care physician, healthcare provider said, really there's nothing else to do, don't worry, you don't have anything dangerous. I know you don't feel well and I empathize with you and validate you with these things. What's the next step? I know we talked about the R's, but does that mean basically, where do they go? People don't know how to do this. They can go to the library and get a book. They can go online. They can watch your podcast. But what's the next step that makes people be able to function better and have hope?
Okay. So first, I'm going to restate what you said, which is the very first step, of course, is always go to your primary. Never skip that step. You must rule out the biggies. So I just want to say that again, because it gets dangerous sometimes when we talk about integrative medicine. After that, you need to walk away from the primary care. Because if you keep going back to the primary care, you said it, you are constantly looking for a test. Mm-hmm. And if you keep going back, you're going to get frustrated, and and that is not the role of your primary care or your specialist is to find some sort of test that can be validated and treated. If it is not found, there's no point in going back again. Why don't you find it and do it again, do it again? Now you have to switch. And you go, my recommendation is to find someone in functional medicine. So whether it's me or someone like me in functional medicine, integrative medicine, or to your point, there's a lot of information out there now about functional medicine, and understanding that conventional medicine has its limits And now you're in the realm of, I have symptoms, but everything is negative. And that is the validation. So what we do is we will track all the symptoms. We have like a very intense questionnaire that tracks the symptoms. And then we use those symptoms to track our progress, because all the serology is negative, right? All the testing is negative. So how do we know if our interventions work? We track the symptoms. Did the headache go away? Did the tinnitus go away? Did the stomach pain go away? Did the joint pain go away? And to quantify from a 4 to a 3 to a 2 to a 1. So you actually use your symptoms to quantify. We actually graph this out to quantify improvement. So the first thing that we do, we always say start at the gut. Start at the gut. That doesn't mean that all your solutions are at the gut, but I alluded to some other issues that might be going on, right? Whether it's mold or Lyme or something else. You will not be able to handle the protocol of any of these other treatments if your gut is not on point. So you start at the gut. So how do we start at the gut? We recommend initially a pretty intense elimination diet. Initially, temporarily, not forever. And the reason we do that, there's a lot of fancy testing out there, and you can end up spending thousands of dollars, and we try to avoid having to do that. So by doing this elimination diet, it's what we call clearing the weeds before planting the trees. Let's see how good you feel once we do a pretty intense elimination diet. So gluten, dairy, legumes, grains, not just gluten-free, we just grains, sugar. Let's see what that looks like in 30 days. Which symptoms improved and which symptoms didn't? So all the symptoms that improved, and it's quite remarkable how better people feel after 30 days. We've already established a root cause. When you eat, I don't know, an eggplant, your belly hurts. Now, you're not allergic to eggplants. That's why it came up negative for you, but you have a sensitivity. These are the type of things that can only be done by trial and error, if that makes sense. So that's where I would start. I would start with turning to a different type of provider. Don't get frustrated with your PCP, because they're doing the best they can. And then starting with an elimination diet.
Again, back to, you said all the things that people can eat, and I was trying to keep track. Obviously,
Yeah.
it's hard. So what if in a sense, let's try to make it, if someone's listening, what could they eat that would be reasonable? And again, clearly there's a weight reduction component to everything, to this part. If you're taking out all those things from your diet, people are going to lose a significant amount of weight, and that's for what period of time? 2 weeks or 3 weeks? A month? How long do you start this?
Depends on the person. I would say at a minimum of 30 days,
So
but
it's a trial of a month.
Some people feel so great they will stay on it forever, and then we slowly reintroduce, because you do want to add certain things eventually. There is a weight loss component, but it's really important not to make this about weight, because people could feel better within 2 weeks and they've only lost 3 pounds. They're still in the category of overweight and obese, but they're feeling great because we're focusing on inflammation. And that is the problem. We're constantly focused on weight, lose 10 pounds. If I lose 10 pounds and I ate Snickers bars all day, just losing that 10 pounds, I'm not going to feel better.
You could have an ice cream diet and lose 10 pounds. If
right. But
all you eat is that, as long as the calories go down.
Exactly. But my IBS will still be there. My brain fog will still be there. So it's really important to shift the conversation away from weight. Will you lose weight? Of course. But it is more about healing and removing anti-inflammatories. So to your question, what do you eat? You look at your plate. You look down. The first thing you do is look for colors. You need to have some vegetables on there, and they need to be more than just arugula, right? You need to have some colors.
Is arugula bad?
No, but people, where locally arugula is very popular.
Right.
So it's not bad, but where are your greens? Where are your purples? Where are your yellows? Where are your reds? So put that in there. And spices count too. Spices are also a color. And then you choose a quality protein. If you're vegan, it's plant-based. But if you're not vegan, make sure you have a good source of animal protein. That's up to you. And a little bit of fat, some olive oil, some nuts. That is
there's no carbs, there's no, we avoid the breads.
In the elimination, the grains, because for a lot of people, right, we talked about gluten, but for a lot of people, there's a cross-reactivity. There's a sensitivity to gluten-free grains, and we won't be able to know that until we just kind of eliminate everything temporarily. And tracking, it's really important to track your symptoms, to really focus on which things go. And you're going to be amazed. You're going to sleep better. You're going to breathe better. You're going to be sharp. It is amazing what you feel when you start this.
Super.
Super, yeah.
And any other thoughts about irritable bowel?
Yes. Oh my God, so many.
So again, because we have you here for such a short period of time, so we're going to move on a little bit. And
Let's
we're
do
going
it.
to autoimmune disorders, and you were telling me that the gut is such a big conduit for this whole process. Tell us a little bit about thyroid problems. You mentioned that was something that was a big
Yes.
interest of yours.
Of course, and it seems like a skip from belly to thyroid, but it's actually not. It's a direct route because, as you know, a big part of your immune system actually resides in your gut, right? It resides in your GI system. So if you have a lot of your immune system here and this area is agitated, it stands to reason that you will have an immune issue, an autoimmune issue. So Hashimoto's is very common, thyroid issues are very common, and one of the reasons is because our bellies are so distraught. So you have this angry IBS belly, this leaky gut, this food sensitivity, which is creating an immune response. Generally speaking, these patients have a genetic predisposition. Grandma has it, your aunt has it, someone in the family has it. Then you add the component of inflammation of the belly, and a lot of people Hashimoto's will have that gluten sensitivity. And now they develop this immune response, and the immune response for them is attacking their thyroid. So there's this clear connection between the nutrition, the belly, and the thyroid.
So what do you think, when you talk about Hashimoto's disease, which for the audience is an autoimmune disorder that affects the thyroid, and most times will make the thyroid go lower. So you have to get supplementation. That's why drugs like L-thyroxine or Synthroid are so commonly used. So tell us a little bit, how do you get from there to there?
Okay, so your thyroid's right here, and it's in charge of producing a thyroid hormone called T4. And for some reason, it stops to work. We'll get to that reason in a moment, right? So it stops to work, and it's not producing enough of that T4. So we prescribe, just like you said, Allan, prescribe some Synthroid, which is basically that hormone. You take it orally, and it feels like, okay, everything is fine now, right?
And the blood tests are all normal.
The blood tests are all normal. You're taking the right amount of pills, everything is good. That blood test, that TSH is good. But what happened? Why did this stop working in the first place? That medication did not address that question. It did not fix anything. It is just normalizing the hormone that your thyroid is no longer producing. So there is a whole theory that says that the thing that happened to this thyroid that made it not produce the hormones is an attack, an autoimmune attack. And there was a lot of studies that show that autoimmune attack originates in the belly through something called molecular mimicry. So the idea is, again, sorry if I'm oversimplifying, but if the idea is that you intake some gluten, you're gluten sensitive, you have a leaky gut, it goes into your system, your body creates a response, right? We all know what antibodies are now because of COVID. So your body creates this antibody to gluten. And the gluten protein is very similar to a particular enzyme in your thyroid. So when you have an antibody to the gluten, you're producing an antibody to your thyroid. So every time you're eating what you think is a very healthy whole wheat turkey sandwich, you're actually creating attack to your thyroid. And over time, you have your pizza and your pasta and your whole wheat sandwiches, and over time, you are creating this attack on your thyroid until one day you go to your primary care office and that test is off and they give you that medication. But if you don't stop this attack, you will constantly need a dosage adjustment. This is why people start at 25, then 50 and 75, and they're like at 225. Why does it keep going up? Because we've never addressed the attack. So one of the things that I will do with my Hashimoto's patients, with all my autoimmune patients, is fix the gut. Because there's this understanding that if my immune system is there, I need to calm it down. I need to calm things down exactly where the attack is happening.
Tell me about, as a neuroimmunologist who does a lot of work with MS, it's very commonly known that women will have these disorders much more commonly than men. Almost all autoimmune disorders. Is there a genetic component, or for some reason is there a sex hormone component to why women will have these problems more? Things like lupus, things about rheumatoid arthritis, numerous psoriasis, almost all autoimmune disorders are much more commonly seen in women. So if it's all the gut, is there something about women's guts that are different than men's guts?
I'm not sure of that answer. I would hazard a guess that if we're looking, especially if we're talking about women in perimenopausal or postmenopausal age, which tends to be the case, I would hazard a guess that when we're talking about overall unwellness, you want every system in balance, right? So if you have years of eating a certain way, and that's the female and male counterpart have that, but now you've added the component of a hormonal imbalance that happens in later years. I think it's just one more thing that sets the stage. Remember I said earlier, like COVID kind of pushes you over the edge. So I think since women also have a whole different, right, whether it's from their periods to pregnancies to perimenopause to menopause, there is a whole other system that needs to be balanced constantly. And with the slightest imbalance can send it over the edge.
Tell me about probiotics. So again, the same way, I'll look at it in two ways. Physicians, healthcare providers all want to find a test that's positive, and then we could sink our teeth into it. Patients all want a pill.
Yes.
There's a pill, and as I said before, I'm an expert in the field of MS, and almost all my patients with MS will say to me sometime, do I have Lyme disease? And treatable with antibiotics, it becomes an entirely different process. Sorry to say, most of the patients don't have Lyme disease. And so the question comes down to is, when you talk about the concept of this changing diet and doing things like that, most people would say, okay, great. I'm going to go to CVS and get a probiotic. To heck with the colors, to heck with anything else. I'm going to take this probiotic, I'm going to put the right bacteria in my gut and make it all right. Does that work?
Nope.
How come?
That was the quickest answer. Okay, there is no shortcuts. There are no shortcuts. There are no shortcuts. That's it. There are no shortcuts. So, you know, even with MS, by the way, I know a lot of your tests are negative, but there are also different labs that, you know, we should consider when we accept that negative. But that being said, it is not just about putting good bacteria back in. In fact, if you take probiotics too early, you'll create such a mess. It's not, you know, there's still bacteria, and if you're putting it in there and it's already a hot, inflamed mess, you're just going to feel really unwell. So there is more to it than just the bacteria. It's also the inflammatory piece, and it's also healing the gut lining, but it's also reducing inflammation everywhere. So I've been focusing on the belly because that's what we're talking about. But when I'm focusing on the belly, I'm actually calming everything down. I'm calming down the vasculature and the joints and the muscles and everything. So it is not going to be enough to just take a probiotic. Is that our cue?
No, we still have it. We have a few seconds.
Okay. So there is never a shortcut. You have to do all the work. If you just want medication, or just one pill, don't even bother going onto the integrative side because there's a lot of work on this side.
Okay. I want to thank you. You know, I think you're fresh, very bright, very clear perspective. Really has a lot to do with getting people better. And I really want to commend you and say thank you for all that you do for your patients. And they all love you. I know a number of your patients, and people have come to our office. So I want to say thank you, and thank you for being our guest. We hope to have you back again.
Thank you. It would be an honor.
Have a good night, everyone.